At this time, it is my pleasure to introduce Rob Harding, the president of FormFast. Since 1982, Rob Harding has been the founder and CEO of FormFast, which is now the largest software company specializing in the healthcare vertical market for enterprise workflow. Prior to becoming an entrepreneur, he held sales and marketing management positions with several national document companies specializing in healthcare. His most recent role prior to starting FormFast was the creation of a best practice electronic document suite for the healthcare market. Rob holds a BA degree from Amherst College and an MBA from Iona University in New York. Rob also serves currently as the chairman of the board for the Gateway Homeless Services, which is the largest emergency shelter in Missouri for women and children.
Thank you very much, Laura, and welcome to all of you on day 2 of our user group meeting. First, for those who could not join us yesterday, I'm going to do about a 5-minute review of the company history and kind of who we are. We did that yesterday, and we're going to do it even more quickly today. But I just want to make sure that everybody has a chance to know what FormFast is and has a little background before you participate in the events of the day. Very quickly. Our corporate background is we were incorporated in 1992 in St. Louis. We were originally a developer of a suite of electronic forms software, and now we would more define ourselves as an enterprise software, a workflow company with a strong form presentation component, which is something that we had found other workflow companies did not possess. All of our source code is owned and developed in-house, and with 63 new customers who came on this year, we now have over 800 hospitals. So we have kind of 2 parallel developments of our product. One is the printing technology side, and the other is the workflow and fillable form side. And we'll first do just the printing technologies. In 92, before you could really push a printer file through a network, we worked with printer resident solutions where forms were stored on media and printers. But quickly, the network world got better, and in 93 we released Form Central, which was a mainframe solution for on-demand printing of eForms, and it was deployed in a lot of small hospitals. A lot of customers actually there are 180 customers still using that character-based product. In 1998, we released Fast Print, which is our Windows solution. That's in output management, and it's for on-demand printing of forms. And the common applications there are admissions, check statements, insurance claims, radiology. Were the biggies. Followed by the release of Form Imprint now 10 years ago, which is an interface which most all of our users are taking advantage of, through which nurses print clinical forms and orders as needed. And then 2002, we released e-signature for patient consents, which has been always a difficult arena to work in, but we have seem to have been chosen by the market as the people to do that. So we've developed a huge expertise in that area. So with these printing application, technologies, you can see the common applications, but really the bottom line that drove so much of this was the need for better patient identification, in the admission areas and nursing areas, and the need to identify forms which would go into document archive systems. So everything had to have a barcode on it with a patient ID and a form ID, and if you're going to do that, you might as well go to on-demand printing and save a lot of money. And that's what many of our customers did, and that's how they got here. Product development history on the workflow side. In 2003, we released Fast Site, which is a web-based repository to store all electronic forms, and that doesn't just mean forms, but procedures and aftercare instructions or continuing education. Had a great version control aspect to it, and it was a great platform on which to build, so that in 2005 we then released FastFlow, and when you clicked on a form that was a FastFlow form, it would immediately open and present you with a workflow, with a form to fill out or an opportunity to scan something in and to take that through an approval process, an update process, and an archive process, and then an application of FastFlow, but a highly specialized one, is our RAC audit workflow, which is really part of a set of a number of audit workflows, of which RAC is just one. So what are the most common things we do there? Well, HR processes, contract approvals, risk management. There's currently about 60 fully built workflows available for you to choose from, in that workflow world. So, and question often comes up when people come across our product and they weren't responsible for buying it. Why'd you buy it? Why is it there? We are the dominant vendor, so most hospitals that use this type of product use our product. It was heavily pushed by the patient identification and reduction of errors guidelines from JCO. The going green, of course, was a big push when we started the company, and has become a big push again. We were pulling out some of our old literature from 15 years ago, so we hope we can do a good job of doing it this time. We are an enabling technology for EMR. We are a platform for stimulus dollars. So these are all things that come into play. I showed there's some major technology partners. We'll talk more about those, so I'm not going to go in those in any kind of detail. Probably the most important thing that we're coming across these days is a lot of conversion services. Our technologies have a common development platform, so whether our customers started with printer resident forms or Magic or whatever it might have been, we're able to move all of the forms and most of the logic from one platform to another. We're also have built considerable capabilities around converting products that were installed from other vendors, where those vendors have not stayed focused on the business. We've built conversion software so that we can easily convert those other packages, onto our platform without a lot of development cost there. Of course, there's the consulting and services division. We all have those. Ours is plenty big for your needs, but one thing I can say is that it's overall rather small next to those of other companies, and that's really not because we don't want to do it, but because the software does such a good job that the need to have lots of consulting people in working on the FormFast product, just hasn't been there. Hosted SaaS is, we've been talking about that the last year or two, and that's now become, becoming a standard. So there's a migration there that you may want to ask us about. So it brings us back to the guy we're looking at yesterday, who is the non-stressed out looking CIO, imagining how FormFast would magically take him to the high-performance hospital. So perhaps not so magically, but we're working on it. I thought that it would be helpful to take you down the road of, who are our customers. So we have 800, which is quite a few, but I do want to welcome our new customers who've come on in the last year. There are 63 new enterprise customers, so I want to welcome those customers to your first user group meeting, and I hope that you'll find the content of the meeting useful. Of these, I don't know the specifics of all of these orders, but some highlights. Beverly Hospital, which we completed last year, was our first live Meditech 6.0 upgrade. It went very well, and we encourage you to talk to the folks at Beverly about how that went. California Hospital Medical Center is notable in being one of our first enhanced services contracts, where we've taken over all of the management of the product through our in-house staffing. So that's moving very quickly as a trend. Centura in Denver is a new customer. They're 2,253 beds, and most of you are familiar with them. They're using all of our printing management products and electronic signatures, so we welcome Centura. At Community Hospital Ventura, we're implementing our fast flow workflow and doing some very interesting applications there. It's great to have a product that could be used for most any application. So it's fun. Welcome to Desert Valley. They're they're part of the Prime group, and a new member there. And we have now gone live at Doctors Hospital and Renaissance in Texas with our rack audit product. So they've been running since the beginning of the year very successfully. We learned some of the lessons that we needed to learn, and we feel at this point very confident, that we understand the needs of a rack audit process. Also, Edward has been a customer for many years in Illinois, but we welcome them. They have purchased our Meditech 6.0 upgrade, and we look forward to bringing them to the next level of our technology. Moving on, from there, Flagler in Florida is doing some new things, in some new ways. They're using our workflow for risk management, and we'll be building reports for them to their PSO, which I think most of you know what that is. That's Patient Safety Organization, and there'll be a lot of need for all hospitals to report to the PSOs, and there'll be various formats involved. So if we capture incidents and things at the beginning of a process, and then we'll be looking at each state, at each requirement for how do we pass information from there. We'll also pass information to the state of Florida. We're also at Flagler doing human resource staffing analysis with the workflow product. So our people are having a lot of fun doing new things with the software. Gillette is a new installation with managed services. So that's another managed service account. Howard in D.C. Has been a customer for many years, but has become a managed services customer and is now putting our workflow, some of our workflow applications to work there. They got an ROI and a chart request and a couple of other things sort of built around the needs of medical records. Then last page here, Rome Memorial is an electronic signature customer. We have quite a few new customers in that area. St. Francis Hospital is in Cape Girardeau, right down the road from us, is we welcome, and they are a case of a customer that had 1,800 forms with a competitor and needed to move to a more updated software, and we were able to make that conversion for them at a very reasonable cost. So a lot of the times, you'd like to move from one system to another, but it's just not cost effective, and we've worked very hard to build automated conversion programs, for competitor or competitive products where it may not be meeting your needs. Twin City is an e-signature application, and I think the last one I'm familiar with is University of Maryland. We're very pleased to have them on board. They're a complete turnkey managed services contract. It's a contract for the system. I think we're starting with 4 hospitals, putting those together. So it's a lot of different things going on, and our folks are continuing to learn more about the needs of different workflows and different departments, and I think they're getting better at learning to serve you. As far as customer size, I was thinking about that. Do we really have any changes in that area? And so I looked at bed size on our customers, and we have 5 that are under 100 beds. They're Cascade Valley, Lourdes Medical Center, High Desert, and Desert Valley are all under 100 beds. And then on the high side, we've got Orlando Regional Medical Center with 581 beds, Norton with 1,348, and Centura with 2,253. So one of our goals is to be able to service any size or type of institution, and we have thus far been successful at doing well on both ends. So we are growing, and why do you care? Why do you care if we're a growing segment in the market? And that's because many of your daily problems are surrounding products which are sunsetted or have not been successful enough for the vendor to warrant robust continued development and bug fixes. So we're pleased that we have been able to maintain our growth, and you should always look to hear that we're continuing to do that. Many of the same factors apply to customers or companies who buy or don't buy subscription-based software, and many of our customers are now doing this, and I thought it might be fair to comment, why, you might or might not do that. And well, let's just say in a more perfect world, and many of you live in this more perfect world, you buy software, you have your best people who never turn over, get trained just once, and your support requirements continue to grow smaller each year as you get better. And many of you have that more perfect world and easily maintain software without any services. However, much of the world is getting less perfect, where the people who are trained to support our products turn over or are reassigned, and the hospital resources to provide support go into decline, and then you've got a good product not getting used. And in those cases, it may make sense to focus your top internal resources on your core clinical and financial businesses, and to let us do what we do best, which is to support the FormFast products. We've worked very hard to develop models internally for support, so that our staffing levels and troubleshooting skills are very strong 24/7 for those who want to use us as an IT resource agent. New things, new customer trends. These are somewhat evident, but we talked about the range of major healthcare systems, from large to critical care, that we are meeting the needs. New customer trend is the large number of managed services customers, number of workflow installations increasing geometrically, the hospitals using subscription or hosting services are now the majority of new installations, which I would not have bet on a year ago, or 2 years ago, as there was a lot of resistance to outsourcing and using subscription types of financial modeling, and it has definitely changed. So we are glad that we were able to support you on that. And the new trend is converting from older FormFast products to newer ones, and we continue to provide you with the ability to use our form design to produce forms which can be utilized in any other system that you might have, where you might need them. So the ability to generate, Word documents and HTML documents and PDF documents, from our form designer is very important to allowing that designer to be your universal design tool. Business partners. I'd like to talk a little bit about our, what we're doing in this area. First is McKesson. Not necessarily first overall, but first on the list. And we're getting closer to our business partners. We're building new relationships, and we're looking really closely at what's important to you and what's not important to you in these relationships. And we've done a lot of work on interfacing, much more than we've done in previous years. But with McKesson, we've integrated FastFlow with the McKesson solutions. We've launched, we can now launch FastFlow from the McKesson web station. We've got over 50 McKesson sites using Physician Query, and we're going to be a sponsor at the Insight Conference. So strong relationship there. With Meditech, we have been now selected as Meditech's e-signature partner. We've always been a strong business partner at Meditech, but this is a very specific situation where we are always in place for that, and are working closely with the Meditech folks. It's the the workflow, of course, is available to Meditech clients, and there's a lot of activity there. There's a FormFast conversion tool for Meditech 6.0 and SCA customers, and sponsorship there, of course. Highland and Valco integrations. Sean Curtis will talk to us about integrations in just a minute. Hewlett-Packard, it's been a long relationship with them, formally for 2 years. We share many mutual clients, so there's a lot of activity working through HP and EDS, and looking for ways to make your lives better. Quadramed, we know, been a partner for 4 years, and we're doing a lot of interesting things there in terms of formatting electronic medical record output. We have a project for that. Or, of course, do their user conference every year. Xerox is a business partner now 5 years, and now working with ACS, we're greatly expanding on this business relationship. Dell, Perot, through acquisitions of theirs and ours, we've now become a Dell and Perot partner, and the discussion, really these discussions are around, how do you get consultants to take an overall document program and make it work for you, and if they can get C-level people interested in controlling documents and understanding the cost of not controlling documents, then that's a real plus. Keen is now a partner over 5 years. MedPlus is let's see, we have a fame for MedPlus is that there are over 5,000 forms archived at Akron General that are in use. So that's a lot of forms, and a testament to our ability to create too many forms. And we hope that we're not responsible for that we're not too good an enabler there. And Microsoft, as we have established a new and strong relationship with Microsoft and their SharePoint products, we're pretty excited. Our just to describe the scenery there, our native workflow product has its own native database. We also commonly will, when a workflow is done, put the finished product into HPF or medical SCA or document repositories from, we have, I think, interfaces to all known players there, but usually those are medical forms which are going into those repositories. So what we're seeing now is the emerging standard is the use of SharePoint as a platform for storing documents and processing documents and workflows. And due to customer demand, and the demand is saying that the most practical approach for a customer is to use SharePoint, as one platform to handle a lot of internal requirements, but also to be the base, for the workflow, for the fast flow workflow. So that's a major area, and we'll be Sean Curtis will shortly be talking about that. So I believe I've covered everything that I wanted to cover for you. We'll, of course, be taking questions later, but at this point, I'm going going to turn the program over to Sean Curtis, and I'm asking Sean, if he can provide some detail on, what are we specifically doing with Meditech, McKesson, Highland, Microsoft? I mean, what are the interfaces? What do they do? Why does it matter? If you have questions on other relationships, also ask Sean, since we have many formal and informal relationships, and we've probably worked with anybody that you would like us to work with. But to tell us more, I'm going to turn the program over to Sean. Sean?
All right, thanks, Rob. So since we're on the Microsoft slide, I'm going to start with Microsoft. That's a pretty big development for us. What we found, like Rob said, was we want to provide the ability for our customers to launch multiple applications throughout their hospital, not necessarily all clinical, but also the things that happen in the business office, the things that are focused around revenue cycle, HR, contract management, more collaboration and case management type workflow, and then being able to store that product at the end of the workflow in a repository or a records management system. So we looked around for a strong records management system, and we found that Microsoft has already put one in place at almost every hospital in the country. So if you own Microsoft Server technology, it came with some Microsoft SharePoint on it. So that was an easy way for us to allow our users to leverage what they already have without incurring a lot more cost. And then, of course, there are advanced features, and the pricing around SharePoint is another issue beyond, the standard what you get out of the box. But it's a great starting point for us to give customers what they wanted was, basically give me an electronic file cabinet to store all this information in, be able to search it, be able to pull it out when I get that accreditation survey or the surprise visit. I want to be able to go to something quickly and pull this information out that I've got. And we chose that SharePoint is going to be how we can go to market quickly and give you a pretty robust solution. Not that we're going to exclude any other development that we're doing with other partners and other vendors. We still have a lot of integration with other imaging and archiving systems that we can go to market with if that works better for your organization. But with SharePoint, what we provide is some more transactional power to the SharePoint system, and I'm going to kind of bounce between a couple slides here. We had a webinar last week with Craig Leclerc at Forrester, and he explained a little bit about SharePoint and what it offers. And so I'm going to bounce up to this slide, and then I'm going to bounce back to this one again. This is one of the slides from the Forrester webinar that explains where in the market SharePoint is sitting. So we're looking at over here on the left, SharePoint 2007 was good in this area of project coordination, content organization, etc. SharePoint 2010 adds a lot of social interaction, more of that Facebook Web 2.0 type interaction that brings it forward into more useful departmental deployments and group sites and things like that. But where we sit as FormFast, we're more on this document-centric, human-centric, case management and business process management area. So there's not really an overlap. That's an area that SharePoint needs to grow into, and maybe they will in the future. But right now, we find that we can link into the features that SharePoint offers and have a value add of this document-centric, familiar interface, this human-centric, meaning we're looking at what the people are doing today and being able to replicate that inside of a system that they're using electronically. So we provide that into the SharePoint environment. So it seems like a good fit for us and for our customers to be able to use that. What we add is the eForms and the workflow to SharePoint. So we're easier to manage and deploy our workflows. A lot of the workflows, you'll hear SharePoint has workflows. So some of that workflow is the workflow that is inherent to building, SharePoint applications and doing business within SharePoint itself. So it's kind of internal to SharePoint. The workflow that we provide is more the transaction between people working together, submitting forms and requests, managing contracts, managing rack audits. Those types of workflows are what we're talking about and what we're delivering on the SharePoint framework. And then we're leveraging the records management. So that's the primary focus for us, is giving you that electronic file cabinet, giving you the records management, the capability to set advanced records management features like retention models and greater search capability of the content that you push into this repository after it's come through a workflow through FormFast. So in addition to that, so we're not just using the records management part of it, we have web parts integration so that you can deploy SharePoint sites. And so kind of the paradigm of SharePoint is it's a giant server, and this server has small sites off of it. So you can have a departmental site for just your group to work on. If you have a project going, you can create a small website quickly and easily with SharePoint and deploy pertinent information, calendars, and group collaboration sites through departments in your organization. So what we do is we put out web parts that allow you to integrate our product and our content into the SharePoint site. So you might have an application that focuses on contract management or HR, and in that application you want to use several of our workflows, or maybe you want to publish several of our documents that are policy and procedure documents through our system through SharePoint. So you can publish that and distribute it through SharePoint, still using the core technology of FormFast. We're just allowing SharePoint to have access to that in a special way. And then it also gives us, this way, a lot of places are worried about the single sign-on, the lower maintenance of fewer pieces of technology. So this gives you one tool to manage these line of business applications and distribute that. So you can have a set of web parts from FormFast that users can go out to, grab the web parts that they want. Maybe it's a category of forms or applications, or maybe it's specific applications, or maybe it's a view into a specific part of their records management repository, and build kind of a portal website for a group to work on. So that's kind of where we're playing with the SharePoint solution. So being able to distribute the access to our applications through SharePoint, launching the applications from within SharePoint, tracking the workflow progress. So these are core things, core things of both of our solutions together. So being able to distribute it and launch across your organization is what SharePoint is about. Being able to manage and track workflows from within that single interface is what we're about. So giving you that ability, and then archiving the final documents in SharePoint, and in the end you're going to be able to share and collect data through SharePoint. So I talked yesterday a lot about our workflow product and how the difference is and the advantages of taking paper-based products or uncontrolled processes, paper-based processes, and turning those into electronic processes where now you're collecting a lot of information and data, being able to dig into that data. SharePoint has a product or an add-in called the data catalog. So you can add our data as a data catalog and tie in business intelligence on top of that. So there's a lot of options that you can go to when deploying SharePoint in conjunction with FastFlow. So the next integration I'm going to talk about is McKesson. Rob had talked about a little bit of our integration with McKesson, where we've been working closely with McKesson to marry our interfaces a little bit more. We have an API for any portal solution, so any portal solution that you have can use our API to launch workflow applications, display categories, display different workflows, or track progress through that portal application. We've gone a step farther with McKesson and basically joined with their development teams to marry these a little bit closer. So I'll show you a couple of screenshots, and as Rob had mentioned, the code and query is in use in a number of joint customers of ours. The way it looks, this is a screen of McKesson's web portal solution, and so what happens is when a user is in this solution, they can select from a external launch button, which is what they're calling it, as an external launch drop-down list. They would select the fast flow application. By doing that in the background, what happens is we're gathering all this information of demographics and other information that's available to us through the McKesson system. So they're passing that over to our application. Our application then launches the required document, so they can pass parameters that says this would be for the code and query. So this would launch them into the code and query application where they could choose the proper form. Once they choose the form, we'll apply this patient demographic information to that form and be able to route that intelligently based on that information that comes in. The next step is we then, here's a picture of the form. So routing, we've pulled that data from the call to us from that application. We've pulled that data and we've placed it onto the form. So the form's now 80 to 90% completed just automatically by clicking that link. And now there's just a couple of question fields that need to be filled out. So in this scenario, the coder goes in, fills out the question, and hits the submit button. The next piece of integration that we've done is added some web services so that inside HPF WebStation, they're able to add to this deficiency list for a physician specific deficiency types that they didn't have before. So in this scenario, it's a code and query deficiency type I'm pointing at here on the left. That shows that in the code and query deficiency type, there are two records. So if I go to the next screen, you're going to see what would happen if they click that button. They would see, and this is familiar to our users, they would see our inbox view, which gives them the ability to launch any of the code and queries that are there. They'd go in and fill out their portion of them. They also have the full capability of our inbox right there in WebStation. So the physician goes in, they have the completed form from the coder, so all that information is up above here. They have just a couple of questions to fill out. Their signature is applied to the form. The next step, of course, is going back into HPF. So now the completed form, the finished form, lives in the repository of HPF. So there are three parts of integration that we really covered. There was the external launch, so launching FastFlow from HPF WebStation, passing the context over, being able to direct the user to the proper set of forms. That's one part of the integration. The second part of the integration was the web services, giving HPF the ability to query our system and find out how many coding queries are outstanding for a certain physician. And then the third part of the integration is, of course, what we've always been doing is passing the document back into HPF. So then it's automatically indexed and placed back into the system in the appropriate area. So that same type of integration, that's I gave the example of the coding query, but those three pieces of integration are integrations that can be applied to any of our applications. So if you're using an application, you'd like to launch it through HPF, we've got an app for that, and we can go ahead and do that. Next, we want to talk a little bit about what we're doing with Meditech. Meditech, we've done a lot of work around our e-signature. A lot of our Meditech clients already have e-signature or are going that direction. So we've done some work with Meditech, some educational materials and some integration with Meditech to really deliver our e-signature more effectively through Meditech. And that's been a great bonus for us and our customers. And then on the workflow side of it, we've also introduced user synchronization tools. So now for our Magic customers, we've created a system to export user data out of Meditech Magic and then drive that data into our FastFlow application. So users are then able to log into our FastFlow system using same credentials as they would in Magic. So that's a nice piece of integration to keep the flow of work flowing through the organization and through the two tools. And of course, the next part of it has been the Highland cold feed interface. Highland's acquired Valco. We have many customers that are using Meditech and Valco, so we wanted to make sure that if our customers chose to go down the road of changing from their Valco system into the Highland system, we had the integration in place, and we do have that integration in place. It's a very sophisticated interface. It's an XML interface that we've created, and so we just feel comfortable in releasing that out to our customers who are going into the Highland arena as well. So we're happy to have that done and available. So that's the recap that I wanted to do on just the integration part of our partners, and I'll turn it back over to Laura.
Great, Sean and Rob, thank you so much for that insight. Sean, we did have a question come in from one of our attendees, Dion Dennis. He's asked if patient information can be accessed through a mobile device. Could you speak to that?
Yeah, with our web applications, we have seen, we've done a little bit of testing with mobile applications through web form imprint or for FastFlow products. So as long as you have the right plugins, for example, with FastFlow uses PDF forms. So if you're able to use the PDF forms with FastFlow on your mobile device, there's really not an issue with that. Same with our web form imprint. We've seen that the interface is capable on mobile devices. If you're interested in going down that road, we'd really love to get involved with you and see how you want to deploy that so that we can make sure that our systems do work that way.
Great. Thanks, Sean, so much. I really appreciate that.